Now, a quick housekeeping note. If you are a New Economy Forum delegate watching live on our platform right now, please remember to submit questions to us by clicking the Ask a Question tab below the video player on your screen, and I will try to make sure to ask them on the air. If you're watching on our live stream, you can send along questions as well to our moderator on Twitter using the hashtag #OurNewEconomy. So let's get to this panel. Our speakers are Stephane Bancel, the CEO of Moderna, Regina Dugan, CEO of Wellcome and Dr. Zunyou, Chief Epidemiologist at the Chinese Center for Disease Control and Prevention. And I am very honored to moderate what I think is a very, very upcoming discussion. All of you, first of all, welcome. I do want to talk about kind of where we are today, because in order for us to look forward, do better going forward, we've kind of got to get a gut check of where we are. Some headlines today: Oxford study confirming AstraCovid shots response in elderly, and then Moderna, the vaccine production is gearing up according to their partner. So, Stephane, I do want to start with you. This has been a big week for Moderna. Your vaccine, nearly 95% efficacy. 5 days, that news came out on Monday. 5 days is a lot in this world, or 4 days, I guess, that's where we are. Tell me what's the update since the news on Monday, and where are we?
So, good morning, and thank you for having us. So, indeed, on Monday, we announced that the first interim analysis of our phase 3 study, that's a study of 30,000 participants, showed almost 95% efficacy. But the piece that makes me almost more excited is the fact that of the 11 people with severe disease, they were all on placebo. We had none on the vaccine. And so if you think about it, what does that mean? I mean that once we get the final data within the next 7 to 15 days, we should be able to see if this is confirmed that if you get our vaccine, you have a 95% chance of having no disease. And if you get disease, you will have mild symptoms, meaning you will not have severe disease. And as we know, it has really been a big impact in terms of hospitalization, for the patient doing the worst ICU, for patient doing the worst death, and all the impact it has had not only on human life, of course, but on the mental health, on the economy. We think this could be a game changer. And so what we're doing now is getting the final data all locked up, submitting this to regulatory agencies around the world, and hopefully, I hope, getting the vaccine approved under emergency use before the end of the year. We're making as much product as we can, and we said we will have before the end of the year 20 million doses ready to ship as soon as we have regulatory approval.
All right, so that's certainly some upbeat news. Dr. Wu, I want to bring you into this conversation. When you and I spoke over the weekend, I believe you were in Xinjiang, or had been in Xinjiang. China has done, and I think most would argue that as among the biggest, the most developed country, you guys have done a good job in terms of containing the virus. But even so, there continues to be breakouts. Where are we in China when it comes to COVID-19?
I just come back from Xinjiang, now back to the Beijing. We just controlled another outbreak in Kashgar, Xinjiang Uyghur Autonomous Region. The epidemic started in the latter of October and brought under control in November. So in the China, I think what we did is have very strong surveillance and control the epidemic as a war. So go back to the earlier response to the initial outbreak in Wuhan. Most of the people suspect China delayed or does not respond very quickly. Actually, I give you two examples. We did a very bold decision. For example, when the outbreak first noticed by doctors, that's last December 27th, and the national experts arrived in the Wuhan, they made a bold decision to close the seafood market. At that time, there were only 40 cases, and 27 of them had exposure to Huanan seafood market. Make that decision is tough, and the national expert and the local expert has different opinion, and the local expert has gone against to achieve that decision. Another decision is to shut down Wuhan city. The decision was made in the January 22nd. At that time, we only have about 500 cases. That decision made had determined the scale of the COVID-19 outbreak in the whole China. The two decisions made, I think, is based on of the philosophy: prepare for the worst scenario. That's on that principle. So we responded to the COVID-19 very quickly. We try to remove all the virus from the community to clean it up and make society safe. So now China, I think, is back to the zero local transmission now. Over.
Regina, I want you to come in on this too. What are you hearing from your network about kind of where we are in this process and in this cycle in terms of dealing with the virus?
Well, I want to calibrate for a moment because remember, the normal time to go from an outbreak to a vaccine is something like 5 to 10 years. So this achievement here is remarkable, unprecedented. The team at Moderna goes from virus sequence to first dosing in humans in 63 days. And as Stephane is fond of saying, that's an advance a decade in the making. In fact, I remember a decade ago when mRNA-based vaccines were first proposed. And the critics said there was no evidence to suggest it would work. And others said there is no evidence to suggest it won't. We should try. And if we are successful, it would matter. And here we are today. In fact, it matters. So I think what we're hearing now is how do we begin to work on the next pieces? So how do we shorten the clinical trial? How do we begin to get manufacturing underway so that we can couple the early warning with a rapid response? And there's still much more to do there. In my view, this is the Sputnik moment of our generation, right? And in the same way that Sputnik inspired a space age, so too might this pandemic inspire a health age. Lots to do.
So I want to continue this conversation because now I want to kind of look forward. A quick poll and a reminder to everybody who's watching, the poll that's out there, we'd love to hear your response. The question we're asking, what are the lessons from Asia's successful response to COVID-19? Some individual freedom must be sacrificed for the public good. That's answer A. Answer B, early lockdowns reduce overall economic impact. Answer C, more investment in digital health infrastructure, including contact tracing. And D, face coverings work. So having said that, and we'll look for those responses. So let me ask you, how do we make sure this never, ever happens again? Bloomberg New Economy said there is no greater challenge for our global leaders than figuring out how to make sure this never happens again. Stephane, can we do this? Do we now have the playbook?
I think we've learned a lot. And as Regina said, I mean, first, what has been done this year by scientists around the world and the collaboration we have seen is unprecedented in terms of the speed. But we've learned a lot as well. And I think there are two dimensions where we should invest aggressively across the world in public-private partnership to reduce the time to get to a vaccine. Because as we know, public health measures are extremely important. And right now, wearing a mask and social distancing are critical. Treatment are very important to take care of people in hospital. But to really get back to normal, we need to vaccinate people. And so I'm going to focus on the vaccine front, which is really the piece I know the most. So there are two things I think we need to really invest a lot on. One is going after the top 10 or 20 pathogens, viruses, that are known to be at risk, and doing extensive work, doing all the preclinical work in animals, run phase 1s, which is when you decide what dose do you need, and then run phase 2 to give you around 1,000 people worth of safety. Because if we had done that for example, MERS or SARS, the first SARS, before the start of the year, when we got the sequence put online by the Chinese, we could have right away gone into a phase 3. So instead, as Regina said, on March 16 to start a phase 1, we could have started a phase 3 if we knew the dose and that already exposed enough people, because it's only a few sequence change of a mutation.
Right.
So that's number one, preclinical and clinical work. And if you think about it, I will estimate it's around $20 to $40 million per virus. So times 10 or 20 virus, it is nothing at the global scale of a planet. The second thing is manufacturing. If we have had a big plant in Asia, a big plant in Europe, a big plant in Africa, one in the US, Northern and Southern Hemisphere, that could make, let's say, 50 million doses a month. You could have had, starting right away in January, make 50 million doses a month. That would make you around 400 million doses per plant by the summer. You have your phase 3 data in June. You'll have 400 million doses per continent and vaccinate a lot of people. think about the different winter we will go through right now.
Stephane, I want to jump in because, right, I understand that we could reduce the timeline. Dr. Wu, come in on this, because I think a big part of this discussion is it all about vaccines? Is it vaccines that save the world? I mean, the WHO came out yesterday and warning that they're not going to arrive in time for us to really deal with this second wave of COVID, and that they should not be seen as a unicorn magic solution. Dr. Wu, are vaccines the answer to all of this?
I think at this moment it's not yet. I think the question you asked about how to let this happen again, I think most of the urgent question, how to bring the epidemic under control, it's very urgent. So just to get the beginning of the winter, the number of cases continue to rise in the European countries, in the United States. Number of daily cases reached to over 600,000 per day. That's enormous. So when we get to the winter, the number of cases will continue. I think the public health measures like wear mask, social distance, hand washing, and ventilation, all of these public health measures still the major effective measures to be used to control the epidemic. So the vaccine, it's a good message, it's a good technical weapons for control the epidemic. However, that cannot be used in the winter or cannot be brought the epidemic under control before next spring. So now we think we need to have two strategies go hand by hand. Public health at one hand and push vaccine at the other hand. Thank you.
Regina, and I do wonder how you see this, because part of the problem, and this is the stories we've been dealing with at Bloomberg, is that this is great progress on vaccine news, but now we have to think about logistics, distribution, refrigeration, and getting it out to developing economies where there is no infrastructure. So how do you see it in terms of the role of vaccines in all of this?
Well, I think Dr. Wu makes a great point, and of course the public health measures are very important for controlling the growth of the epidemic. Now, I see these two things as going hand in hand. They're two pieces of the response. So the better job we can do in surveillance and detecting an outbreak, controlling it with public health measures, and the faster we can make a response in terms of a vaccine, those two things couple to make an even more important and control measures. So the better we get at surveillance, the less pressure it puts on the response. The faster we can make a response, the less pressure it puts on surveillance. So if we just look at the timeline, as Stephane talked about, for a vaccine, imagine that it wasn't 12 months, but rather it was 3 months. What if, using human tissue and organ strategies, we can do a much better job in the preclinical? We can tee up those kind of responses. And then, as Stephane said as well, which I agree with, we need to do a better job on the manufacturing side and the delivery. Maybe we can get microneedles over the line. Maybe we can reduce the cold chain requirements. These are going to require investments, much like the early investments we made in the mRNA-based vaccine.
And Stephane, forgive me, because you guys have been working tirelessly over at Moderna on this vaccine, and thanks to, a few years ago, some investments from DARPA working with the government, you guys were, started to do that early work on messenger RNA. So what are your thoughts as you're hearing this discussion about, we talk a lot too about wear a mask, social distancing, about the importance of vaccines here?
I mean, I totally agree with what Dr. Wu and Regina said. It's not a silver bullet. What we need surveillance to be stronger. We need public health measures, because you have no other way at the beginning. This is your best weapon, and you need to use it well. And I think when you look around the world, you have some countries that have done an excellent job, including, of course, China, controlling the virus. And you have some countries where it's totally out of control. And when you still go today, in some places, and you see people, going to crowded places with no mask, or eating inside restaurants with no mask, I don't understand it. It makes no sense to me. It's like, you're going to get infected. The only question is when. And so I think the vaccines are important. But what I was answering to your question is, what can we do so that next time the timelines are much shorter? As Dr. Wu said, now the big impact is going to really be in the first quarter, in the second quarter, in the third quarter next year. It will take time because we don't have enough product. But what I think we can do for next time is be able to go much faster. As Regina said, a couple months to approval of a vaccine. I think it is doable with the right investment up front. and then investing in manufacturing, because to stop those type of viruses, you need a very, very high vaccination rate. And for this, you need a lot of doses. There's no other way around it.
Dr. Wu, one thing I wanted to ask you is you spent many years in California, so you kind of understand the U.S. culture, the U.S. systems. You've spent a lot of time in China. You understand that as well. So you really understand both countries and systems and how we operate. To be fair, nobody had the playbook on this, and there were breakdowns in the U.S., there were breakdowns in China, there were breakdowns in Europe in terms of dealing with COVID-19. What can China do better next time around? What can the U.S. do better? What can the world do better?
Thank you for that question. I think it's very important for the public health measures. Most important is country need to take action in the same pace. That's most important. So I compare the culture between Asia and Europe or America. I think it's different. In the Eastern culture, we have a community value. Is higher than the individual value. In the United States and European countries, the personal right is the top priority. So given that, it's very hard for people have a common agreement. So I think for the respiratory diseases, the most important is everybody takes the order and follow the instruction, take same action at the same pace. That's critically important. So if in a country people have different opinion and take action in a different pace, that does not work for the control the epidemic. For example, in the Spring Festival, the whole country shut down. It's a complete shutdown, not just part of people. Everybody stay at home for 2 weeks. So we compare strategies, similar strategy used in the European countries, like in the UK or in the other European countries, and also in the United States, some of the states. However, not the whole country takes the same action at the same time. That will not work for control the epidemic. So without get that compromise or get an agreement, it's very difficult to bring the epidemic under control. Over.
I want to bring up, if I can, the results of the poll. I think hopefully folks have been answering those questions, and it asked. Actually, I think we're not quite there, so hopefully people will respond a little bit more. So, Regina, let's go on to how do we change behavior? How do we change maybe investments? How do we change priorities so that we are set up for the next global health crisis?
Yeah, and I would say health in general, Carol. Right? So if you look at the response after Sputnik, what we saw was a dramatic shift in investment and also a focus on speed. And here I think this is a place where we can really make progress. One of the things that I think will happen post this event is we recognize that we can go faster than we've done before, and we should. Because the slowness that we would have under different circumstances is a painful kind of slowness. It's the slowness that's measured in lives we could not save. So if you look at what happened after Sputnik, we saw a dramatic increase in investment. About 2.2% of US federal spending was focused on the frontier of space. About 80% of that was R&D. And it wasn't just the raw dollars, it was also the structure of organizations, deeper public-private partnerships. DARPA was formed at that time. So we need more of that, and we need it in a multinational way. We need it internationally. I think that there's really important lessons there, not only for future pandemics, but also for battling depression and cancer and kidney disease. Much more to do there. If you look at the recent McKinsey study, what it suggested is that $1 to $2 worth of investment in health yields about $2 to $4 in economic return. And that could be a $12 trillion uplift in global GDPs by 2040. It's a very important area of investment. It's not only a moral imperative, it is now an economic imperative.
You're right. And statistics, 10 million people die every year from cancer. Heart disease is responsible for the most deaths worldwide. Diabetes, the numbers are just off the charts. I mean, it's kind of crazy.
That's right.
We do have the results of the poll, so I want to talk a little bit about that. The question was, what are the lessons from Asia's successful response to COVID-19? And if I take a look, kind of an even split here. Check this out. 29%, some individual freedom must be sacrificed for the public good. 27%, early lockdowns reduce overall economic impact. 16% more investment in digital health infrastructure, including contact tracing. And 28% face coverings work. I think that tells the story of how the world has been dealing. I think we all have mixed views, mixed feelings. Stephane, when you see those results, what do you think?
Well, it's a bit disappointing that people don't realize that this is a respiratory virus. So masks work. Are they perfect? No. But do they help if I have a mask and I'm with other people and they have a mask? Do they help? Of course, tremendously. Why do I wear a mask? It's not because I'm worried for myself. You know, I'm a 47-year-old. I have no comorbidity factor that I'm aware of. And so if I get, SARS-CoV-2 infection, I have very little risk of dying from it. It's possible, but it's a low risk. But I don't wear a mask for myself. I wear a mask because I'm part of a community, of a society, and I need to make sure that I don't transmit this virus if I have it, because I will have an incubation time. I may be asymptomatic. I might have mild disease. But before I know that, I might give it to so many people that they then give it to other people and other people. It's exponential load. That's how viruses go. And it's an act of civility in my mind to do that. It's for all the people we protect. By being infected, because I'm not responsible, I might get somebody 10 or 20 degrees of separation from me in a month or two, dying because I was not responsible. And this is why we need to all play our jobs.
Dr. Wu, I think about what's been going on in China and certainly the ability to control it, but it's been very different in terms of how it's been handled, let's say, in contrast to the United States. But you guys have technology, you have an app, people can't get into buildings unless they're clear. So I do wonder, though, you give up, potentially Americans see it as some personal freedoms, and some other global citizens may say, I don't want to be tracked, I don't want to be traced, I'm not thinking about the community. Your thoughts on that poll and kind of the response of how people are seeing it in terms of the lessons we've learned? Dr. Wu. Okay, I think we have a little technical problem, and we'll hopefully get back to him. Regina, you come in on this in terms of, I do think about digital surveillance, right? It makes no sense to have an app that tells you, I'm okay, I don't have COVID, I was just tested. But are we all ready as a world to give up our privacy and share our data?
Well, I don't think those two things are necessarily mutually exclusive. I think we can do more on digital platforms and still protect privacy and use it to help in a severe situation like we had in the pandemic. And I think here Google and Apple worked collaboratively to try and get strike an appropriate balance between those two things. But here again, I think that we have to recognize that an early response really matters. We need a fire break when we start to see an epidemic emerging here. And that means public health measures, early detection, as well as the type of response and improving the speed of that response, even above the measures we've had in this most recent pandemic. Beyond the 63 days and then a year to a vaccine, we've got to get those timelines even shorter.
And so one thing, and I don't know if we have Dr. Wu back, I guess we don't, but one thing I want to ask you all is what we've learned here in dealing with COVID-19, and if we can kind of broaden it out. Regina, you talked earlier about what McKinsey said, the cost of ill health at more than $12 trillion. I mean, this is a significant impact on our global economy and on the lives of people. So how do we deal with some of the big ailments that really stress our society right now? And Stephane, come on in on that. How do we make a better place when it comes to global health, and as a result, really create prosperity around the world?
Yeah,
it's a great question. And I think, sorry, Regina, ladies first, go ahead.
Well, thank you for your graciousness, Stephane. Look, I think I've said some of it before. We need to shift our thinking. I think people are not going to be willing to go back to the speed with which we were making advances before. We've seen tremendous progress in health. we're just not seeing those breakthroughs fast enough. We need different structures. We need different types of investments. We need to embrace these public-private partnerships because the investment matters, both from a moral perspective and an economic perspective.
Regina,
So we've got...
Regina, let me break in for a second, though. What structures, what investments specifically?
So here again, as I mentioned, in the early days of the space age, what we had is a dramatic increase in our R&D. Now, we recognize that dramatic increases are relative, right? But in the US anyway, that investment went to about 2% of our federal spending. That would be about a doubling of our spending in the US as it relates to health. But if you imagine an organization like DARPA, which was formed after Sputnik, that organization has been responsible for big advances well beyond the space age. We're talking about the internet as a communications platform. We're talking about laser technology and many other advances that are credited to the agency. And there's a particular style of investment there that is risk tolerant, that is multidisciplinary, that is a blending of academic and as well commercial organizations. And we need more of that kind of investment so that we can accelerate the breakthroughs.
Dr. Wu, what kind of investments, what kind of structures would you like to see set up that would prevent us from having another global health crisis?
I think I have different opinion. Look at the response to the COVID-19 in the science and technology. We responded very well. For example, it only took less than a week. Scientists isolated the virus, determined the pathogen for the COVID-19. That's only about a week. Then take another few days. The virus sequence was discovered and shared with the world. And looking at the diagnostic test kits and vaccine development, now it's only about 11 months. We made significant progress in the scientific understanding and the technology movement. All of this scientific finding, technical movement, provide a very strong weapon for control the epidemic. For example, PCR diagnostic test kit is powerful to determine the epidemic, to diagnose the patient. Now vaccine will soon to be available for prevention. So look at our response to the COVID-19 in the China and globally. We worked very well. I think most important is a policymaker, how to use this knowledge to empower the public to use this knowledge and methods to control the epidemic.
Yeah, I've heard a lot about it. I just want to bring Stephane in, if I can, for a moment, too, on this conversation, because I do think about how does this ultimately change our healthcare priorities? We have someone from the audience asking about that. Stephane, how do we change things going forward? What do we need in our system structurally, money-wise, public-private partnerships? What do we need?
Yeah, so I won't go back to what Regina or Dr. Wu said. We need more investment in science for all the reasons we talked about the last 30 minutes. But I think another piece that is not always talked about too much is the role of education around the impact of food on health, the impact of doing exercise on health. I mean, look at it. Most people that are having severe disease or dying have comorbidity factors. And what are those? Diabetes, overweight, blood pressure, and all the root cause of those things is lack of having good food and exercise. And if you look at the demographics, a lot of minority groups are the most touched by it. And I think education and inequalities is a big issue in this health challenge we have as a society, and I think we need to invest more there.
Yeah, I think that is certainly something that has been laid bare once again about the inequities, whether it's access to health care or who gets impacted by these health things. We only have about 1:20 left. You've got to be quickly. Andy Brown asked a great question in the last segment. If you had a blank check, what would you spend it on? Stephane, just quickly, what would you spend it on?
I will spend it on building manufacturing capacity for vaccines. I will build it to make sure we have override surveillance systems so that we can note those viruses very quickly and act quickly.
Dr. Wu, just got about 30 seconds. What would you spend it on, a blank check, to make it a better world when it comes to global health?
Yeah, I think the most important, we need to have the global authority to coordinate, making sure the resources can be distributed, to making sure people who need can access to the public health service.
And Regina, just to wrap it up, what would you spend it on?
Well, I think the response today is based on a decade of investment that made it possible. I think we need more possibilities going forward. That's where I would spend it.
All right. On that note, I'm going to leave it. Guys, thank you so much. We could probably talk for hours, for days. This is such an important issue of figuring out what we did and where we go from here to really tackle not only viruses, but really the global health situation. So Regina, Stephane, and Dr. Wu, thank you so much. Really appreciate it.